Hi there, I'm Tom Cobbin from Beryl and Watson Lawyers, and in this video we explain the Disability Support Pension, or the DSP, and options for people living with multiple sclerosis or MS. Some people living with a chronic illness will be eligible to the DSP, whilst others might be on JobSeeker. JobSeeker pays a lot less and may require you to look for work in order to continue to receive payments, whereas a DSP is a disability-based pension, and rather than forcing you to search for work, it actually has limitations on how much you can work. If you're on JobSeeker, it could be possible that Services Australia or Centrelink will decide that your injury or illness has caused you to have a permanent working capacity. If this happens, they may decide that you're no longer entitled to JobSeeker payments and kick you off, saying instead that you should be applying for the DSP, or the Disability Support Pension. This is fine if you can actually make the application to get onto the DSP, because it's a very difficult application process. But for people who aren't eligible to claim the DSP or apply and get knocked back, it can cause a lot of issues. So who is eligible for the DSP? There are 4 requirements for DSP. It's not just based on work. First of all, you must have an injury or illness which has been fully diagnosed, fully treated and stabilised. You must have an incapacity for work which is more than 15 hours per week for the next 2 years. In other words, you must be unable to work more than 15 hours a week for the next 2 years. You must have a combined 20 points of impairment under the impairment tables, of which there are 15, and you must undertake or complete a program of support, or a POS. If you have 20 points under one impairment table as opposed to 2 or more, you may be able to get the DSP immediately without having to go and undergo a program of support. That's important because a program of support can take up to 18 months. The relevant impairment tables, as I said, there are 15. The ones that would be relevant to MS could be potentially brain function, physical exertion and stamina, lower limb function, or mental health function. Really, it depends on what functional incapacity the MS presents in you, and that's specific to each individual as to which table. That is, there's no MS or neurological functions table. That's because the tables usually focus on functional limitations associated with an illness. For example, asking questions like, can you lift your hand above your head, or can you manage self-care or hygiene independently? Therefore, it's important that these functional and practical matters are addressed by you and or your doctor when you apply. You have to get medical statements in the process of applying, and a medical statement which says, I, Dr. Jimmy, supports my patient's application for a DSP. That's not helpful. The report really needs to focus on functional limitations, i.e. what you can and can't do in terms of limitations around raising your hands, lowering your hands, what you can remember to do in terms of self-care, etc. Importantly, the 4 eligibility requirements do not apply to people who are permanently blind, require nursing, home level care, or are terminally ill. Such people are entitled to what's called a manifest grant. In other words, they can automatically get the DSP without having to go through that application process. So what do you do and how do you apply for a DSP? Applications for a DSP must be made using the Services Australia forms and need to be supported by a GP, as I said, specialist or a clinical psychologist. They are the people who can support a claim. Other medical experts like OTs or physios can't support a claim. We've developed a how-to guide that can help, a bunch of pro formas that can be used covering the 15 different impairment tables to try and help doctors and guide them through the process. And these can be used as a supplement to the classic DSP forms that have to be completed as per the Services Australia requirements. Also, in addition to our pro formas and the doctor's opinions, whilst you can't rely solely on the physiotherapist or the OT's report, it's still worthwhile sometimes getting opinions from professionals, those that provide you treatments. They cannot be relied on to support the application alone, but it's still worthwhile getting them to support. Sometimes also they help medical doctors, clinical psychologists make up their mind about your functioning in your work capacity. So you can lodge the application and our pro formas and any other material with the DSP application or after it to Services Australia. Once the application is received, Services Australia will usually arrange what's called a job capacity assessment, where your ability to work is assessed. And you may also have a disability medical assessment completed. There's no time limit for Services Australia to make a decision on a DSP application, and it can take several months. If your condition deteriorates during that time, we'd also recommend that you lodge a subsequent claim. Just in case the first claim is rejected, then you can rely on the second if your conditions become worse or change in some way. And if you do apply and your claim is rejected, there are time limits to appeal, and we recommend that you get advice immediately so you don't miss out on making the application within time. Hopefully that helps for all those people out there with MS or other chronic illnesses that are looking at claiming a DSP. If you have any questions, please get in touch. As always, 03 9448 8046 in Victoria. Look forward to hearing from you. Thank you.